Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Today, we're gonna get refreshment on infertility, and then we're gonna go to the next topic, assuming infertility issue has been fixed. So the next topic today we're going to be talking about, after a small review of infertility again, will be pregnancy and what you should look for and what you should do when you get pregnant. Now, let's revise a small time about infertility. We mentioned infertility for women start from the vagina. So we have to be sure the vagina is okay. What issues can we have with the vagina? We can have discharges, vaginal discharges. We can have itches, and we can have pain on the side of the vagina. That is because of the inflammation of glands, those glands on the side of the vagina. When you get this pain and you feel a swelling inside the wall of the vagina, do not panic. It's a very small issue. There are glands there that are responsible for secretion of some mucus that is responsible for the lubrication during the sexual intercourse. So what you have to do is just insert your finger and with a circular motion massage that area, and the clog will go, because those glands have ducts that release the lubrication into the vaginal cavity. So we just have circular motion and you massage with hot water or so, and the cloggage will go. Okay, the cloggage will go, and then you will have no issues. Now, what if it does not go and the size is big? What can we do? In this case, you will go to the nearest doctor, and the doctor will, with a small incision, will drain it out. Before we drain it out, the doctor will apply an ultrasound to see what kind of fluids are there. Are it just free pus that can easily be extracted, or it has transformed into an abscess? In this case, we need to open up with a small incision, and then we clean up that abscess. Nevertheless, it's a very small issue. It doesn't need to be, you don't need to have panic, or you don't have to be scared. It's a very small issue, and it happens that this ducts on the side of the vagina can get clogged from time to time, and that is the way to do it. What are the signs? Your vagina will be dry at most of the time, regardless of excitation. Remember when we spoken about the excitatory phase, the excitement phase during sexual intercourse, we have lubrication. That is the sign that the woman is aroused, is excited, is ready for intercourse. The sign is lubrication. So lubrication being absent, that means one of the causes could be the gland that is producing this lubrication. The canal is being clogged, and that is how you relieve the blockage in that canal. Sometimes the cloggage is for so long it can form an abscess or a cyst. A cyst is just accumulation of free fluids that can easily come out. But if it's an abscess and the fluid is a bit solid and thick, then we need to open and drain it manually by hand. So that is still, even if we have to open and drain, it's a very small procedure. It doesn't take few minutes, and you're home free. So now you know the sign. When you don't have lubrication, one of the reasons could be clogged Bartholin gland, or the glands that are present on the side of the vagina, on the side walls of the vagina. Now we know. But sometimes women come in with discharges. Sometimes the discharge is white and thick. Sometimes it's yellowish, sometimes it's brownish because it's mixed with a couple of drops of blood. Sometimes it smells bad, sometimes it doesn't. Sometimes the vagina is like you put pepper inside. It's like very hot, very burning. So those are all different organisms, and different reasons give you different scenarios when it comes to the vaginal itching or vaginal discharges. In summary, things that we already have discussed before, if the discharge is whitish and no smell, no odor, that is very much vaginal bacterial vaginosis. So it's not really, this is something happen when your immune system drops, for you being stressed for one reason or another, you form this thick discharge. That is benign, that there's no harm in that. But anyway, we have a treatment for it, and then there's ovules that you insert, and then it will be over. The other one that you should be aware of or worry about a bit, when you have an odor, when you have a smell to that discharge and the color becomes a bit yellowish. Now we're talking about a sexually transmitted condition here. So in both these cases, both partners will be treated, and we just take a small sample from the vaginal wall. That's discharge. We take a sample, we look under the microscope, and if we see motility, we see movement, we know this is something else, we know as trichomoniasis. Then we have to treat you with tablets that you will take, and also the husband has to be treated, because failure to treat the husband or the sexual partner, you at risk for the condition to relapse one more time, and then we'll just go in vicious circle, back to back. We treat you, you come back, we treat you, you come back. So both in this case, when the discharge has a smell, then in both cases this will have both partners will have to be treated. Why I'm saying that in terms of infertility? Because vaginal fluids has to be friendly with the sperms, meaning it cannot be too harsh that it will kill the sperms. When I say harsh in medical terms, we say too alkaline or too acidic. It has to be right in between, the right environment for the vagina, because remember, the sperms, the first station the encounter is the vagina. So if the vagina has a lot of harsh environment, too acidic, then most of those sperms will be killed. So if we have a husband that have small amount of sperms, he's not up to the 300 million that the normal count for a sperm. If he has a small amount of sperm, we need to do everything possible to keep this amount of sperms alive and functioning till they get to the final station, which is the fimbria, or at the level of the ovaries, where the egg is coming out from the follicle, right? So a good environment in the vagina will save me a lot of dead sperms. Most of the sperms will survive that first station. The second station the sperm will encounter is the mouth of the uterus, which we call the cervix, and that opening called the os. So now, the os at the level when the time of ovulation comes, that os, usually before ovulation, which early in the follicular phase, this is the first 1 week or 2 weeks after the first day of menses. This is what we call the follicular phase, during which the os is closed by thick mucus that clog up the mouth of the uterus, so no bacteria or anything that is unnecessary to pass through the cervical canal and leading to inflammation or infection of the uterus. So, but by ovulation day, the consistency of that mucus changes and it becomes more watery. When it becomes more watery, now the passage of the sperms from the vagina into the uterus through the cervical canal will become easy and allowed. So one of the obstacles that prevent someone from getting pregnant is that mucus does not change. It does not respond to the hormones of at that ovulation time, and it doesn't become watery. It remains thick. So in this case, there is a problem. Now, the problem could easily be fixed by making this, cervical mucus a bit more watery to allow the passage of the sperms into the cavity of the uterus. And from there goes all the way through the fallopian tube to meet the egg, and then the zygote comes back and implant in the wall of the uterus. We have been through this journey before. So the first station then is the vagina, and the vagina has to be suitable to receive the sperms without doing any harm to the sperms, especially if we have a low number of sperms, that is from the male. Second difficulty, as we just mentioned, is the cervical canal, and the mucus in the cervical canal has to be watery to allow the passage and ease the passage of the sperm into the uterine cavity, and from there we go to the fallopian tube. Now, what can happen? What other difficulty we can have at the level of the cervix? Well, number one, we said the mucus not becoming watery and become thick mucus. The sperms cannot pass, and with that we can treat easily, we can diagnose easily. Number two, we have a polyp, which is an extra piece of tissue or extra piece of meat that is like acting like a one-way valve. Whatever comes from the uterus down, it goes down by means of gravity. Like menses, it comes down, so the polyp opens. That's a one-way valve. But anything that comes the other way, like sperms going up the uterus, it cannot go because the polyp is in the way. And the polyp can easily be seen if the woman we do a speculum exam, and we open up and we can see the speculum there with the polyp there, and that can easily also be removed, so the obstruction is no longer there. So those are all very simple things that can prevent you from getting pregnant, and it can easily be dealt with a specialist. Now assuming the vagina is good, assuming that the cervical canal is good, now we come to the uterus. Now, what problems can we find in the uterus? The most common problem is fibroma, fibroid, or myoma. It's all different names for the same thing, which is basically we have a solid tissue growth inside a uterus that is supposed to be flexible. Flexible meaning when we have a pregnancy, the uterus balloon out like a balloon. It expands, okay, without any difficulty. If we do have a growth, the growth could either be from outside the uterus, we call that subserosal, and that will not interfere with pregnancy, and it can easily be cut off and removed. But what if that growth, that solid ball there, happened to be within the wall of the uterus? That we have a problem. That is what we call intramural fibroma or myoma. Now we have a problem because once the uterus wants to become expanded in response to the increased size of pregnancy, this will not make it grow. This will not make it flexible. This will not make it expand like it's supposed to. So now, in this case, what happened? Well, it depends on the location of that fibroma. The baby can drop because the uterus failed to expand.